Well, as I mentioned earlier, we're talking about prostate cancer, my prostate cancer. And how did I find out about it? What happened? I mean, well, I want you to meet somebody. His name is Dr. Michael Brewer, Inverness Family Medicine. He's a family practice. Thank you for being with us today.
You're welcome. Glad to be here.
This is the guy that saved my life right here. So,
thank you.
all right, Michael, let's talk about what happened. I've been coming here about 8 years, seeing you. My dad had prostate cancer. Let's talk about what you've been doing and what.
Well, when you came in, for a checkup, which is sometimes the hardest part, is to get folks to come in for their checkup.
Yeah. When
you came in with a family history of prostate cancer and the appropriate age, then part of the evaluation included, of course, the prostate exam, which most men try to get away without having done.
That's true.
And then it also suggested that we would do a PSA, or a prostate-specific antigen, on you. And when that came back elevated, then the next step was to investigate further, and then one thing led to another, and then eventually to see a urologist.
Well, let's talk about the PSA. I mean, that's just a blood test.
Yeah,
I mean,
just a blood test.
I mean, it takes about, 30 seconds for the blood test. Right. And the part that guys worry about is the physical examination, which takes another 30 seconds.
Right.
Now,
at most.
Yeah, maybe 10 seconds. Right. Because all you're doing at that point is what?
You're actually feeling of the back side of the prostate through a rectal exam or a digital exam. And it's something that's still the best thing we have going as far as not missing nodules on the prostate and giving you an assessment as to the size of the prostate. Many times men come in for their physical and you tell them that you're planning on, that part of their exam is to do a prostate exam, and they'll tell you, well, I'm not having any symptoms, I don't need that done. And we'd say, well, you're over 40, yes, you do need it done. And the reason for that is that just simply doing a blood test, for instance, misses around 15% of prostate cancer. So I asked the men, if you had a nodule on your prostate but your PSA was normal, would you want me to ignore it? And of course the answer is no.
No, sure.
And I ask them the same thing, the ladies that don't want to get their mammogram, I say, well, if you had a knot in your breast but your mammogram was normal and you didn't come in for a breast exam, would you want to ignore that if we found a knot? And of course the answer is no. So that's why at this point in time, in 2011, the combination of the digital exam to actually feel the backside of the prostate through the rectum, as well as blood tests that we have available.
Now, in my case, we were coming in, my PSA was kind of going up little by little. I remember when it was like 2.4, and then and each time I came in, and we went from once a year to every 6 months because my dad had prostate cancer, and you had recommended, Bob, you're susceptible possibly.
Right, and that's the important point, because when we first found out about the PSA 10 or 12 years ago, we were strictly looking at numbers, and then we came out with the idea that anything below 4 was okay. Then we found out that maybe we had to age adjust that. It wasn't just strictly anybody that had a level of 4 and below was normal, to the point that studies then showed that we need to watch the progression of the PSA. If your PSA doubles in a year, it may have simply gone from 1 to 2, and you say, well, it's below 4, that's okay, but that's not okay. So we've been taught, our urology colleagues have taught us to watch the progression or the slope of the curve and what happens to the PSA over time. So if somebody's in the 50-year-old age bracket and has a family history of prostate cancer, it becomes important to probably check it more frequently than once a year. And then to follow and see what happens to it with time.
And that's what you did. And there was something else. There was the PSA, then there was another test as well.
That's where we can separate the free and total. We can measure the amount of free PSA, which is prostate-specific antigen, that's in the total amount. And it's bound to protein at different levels. And some people a lot smarter than I am have figured out which ones of those, what percentages of those bound proteins or bound PSA represent a higher risk of prostate cancer as opposed to a certain amount of bound PSA.
So at that point, when my PSA and my physical exam was fine, my prostate had not enlarged. But you said, Bob, I remember I got a call from you, and you said, Bob, go see a urologist. And I chose an interesting guy to be my urologist, and that's Eric Brewer. That's Dr. Brewer's son. And found out he had this fantastic reputation throughout not only Alabama, but the whole Southeast. And so that's who I went to talk to, and I want to talk to him next. Thank you so much for being with us today.
Thank you.